I'm Dr. Brian Pinsky, board-certified plastic surgeon and partner at New York Plastic Surgical Group. I specialize in all aspects of plastic surgery, including body contouring after massive weight loss, aesthetic surgery, general reconstructive surgery, hand surgery, and peripheral nerve surgery. What inspired me to become a plastic surgeon is a good story. My father was an orthopedic surgeon. I always thought that I would go into something similar. And in medical school, we do all sorts of rotations, and I ended up on a plastic surgery rotation and absolutely fell in love. Fell in love partially with the personalities that I was with, but also with what they were doing. In fact, I thought the procedures were so groundbreaking and unbelievable that I never even knew that things like that existed. And I just remember feeling like I want to do that. I've been practicing plastic surgery since 2012. I think plastic surgery is constantly evolving and changing and has been that way since the beginning. I think that's one of the most interesting parts of plastic surgery. Post-weight loss body contouring has always been something that's had an interest to me. I think it really combines a lot of the basic principles of plastic surgery, and it's something that you could see on the horizon as something that's going to become more relevant and more needed over time. And it's just something that I feel like I'm good at, and I feel like I can really puts my combination of technical and artistic interest together. It's a lot of work. It's a lot of physical work and time spent, but again, the results I think are transformative, and I think beyond anything, it's just the patients are just so happy and grateful. I've gotten multiple letters over the years from patients who just say, I can't believe I can literally walk into a store and just buy something, which seems like a simple, small thing, but you can really see how that would be a transformative, life event. And I've seen almost personality shifts. People who were once reserved when they first come in to, at the end of their journey are just outgoing, bright, sparkling people that, they wear different clothes, they wear bright colors, they attract attention, staying shy away from attention. It's really, it's just wonderful to see. Making a patient feel comfortable really starts from the moment you walk in the door. I always believe in being direct and honest with the patients. I always believe in really explaining my thinking and doing it in ways that people understand, and really trying to individualize the care for each patient. And it really starts for me with, what do you want to look like in the end? I always start with the patient's desires and then work backwards. And then obviously, sometimes you can have branch points or decision points and say, well, we could do A or you could do B. And both are good. This is why A is, these are the benefits of A, these are the benefits of B, and then you get some choice in the matter. I always say that this is what we're going to do, this is how it's going to work, this is what's going to happen, this is how the recovery is going to be, this is, these are what the potential outcomes are, and this can happen and that can happen, and then we ask questions and we go through it, and I probably go over the same speech 3 or 4 times before surgery in most cases, especially complicated surgeries, so people really understand what they're in for. I wanted the patients to feel like they've had every question answered. The last thing I ask patients, almost all the time is, do you have any other questions for me? And when they say, no, we've covered everything, then I think I've done my job. I think I'm most proud of the fact that I am continuing to change and evolve. I love that. I think that's the best part. I think it's part of our responsibility is to stay up on the current literature, and there's journals that come out in multiple specialties and subspecialties every month that we all read. We go to meetings every year. I'm the program director for residency education, so part of being in charge of training the future generation is to stay up on all these topics and to really be knowledgeable to be able to teach the next generation. So one of the nice things about that is that it forces me to stay current. There's just so much out there. I think a good message for patients considering any type of plastic surgery is just take the step. Every patient on the back end says, I wish I would have done this sooner. I think that most patients really feel like they wish they would have taken that leap, earlier, and just the nerves or that being apprehensive about certain things, kept you away. But just come in. We'll have a conversation. There's no commitment there. I think it just allows you to be educated and allows you to really make an informed decision about what's right for you. And I think you'll find that these things are a lot less intimidating and scary than you might think. I see patients in Babylon, in Huntington, and East Hills. We have a main office in Garden City where I do some consultations and surgery, and I would love to see you.